Well, Dr. Aigoro, there's this common, oral health conditions that but you will agree with me that so many people some people are down with mouth odor.
Yeah, that's true.
Do you agree with me?
Yes, that's true.
So, what's the prevention for that, or how can that be managed?
Okay, so in our own field we call it halitosis. That's mouth odor. So many of these conditions that I mentioned before also too could be predisposing factors to mouth odor. So although yes, we have what we call psychogenic mouth odor, in terms of whereby some people think they have mouth odor, but maybe they don't. When they come to see us, we try to educate them. But there are some people that actually have what we call true halitosis, which is true mouth odor, and sometimes it could be as a result of dental caries in the mouth. So there can also be as a result of some other conditions, periodontitis too, could also predispose as the gum diseases to mouth odor. Then poor oral hygiene also. So when you don't take care of your mouth, when you don't brush when you're supposed to. So that will also predispose to mouth odor. Then also there are other conditions too, like dry mouth, when the person doesn't have enough saliva, because saliva helps in cleaning the mouth. Wow. So conditions like that too could also predispose to mouth odor. But most importantly is poor oral hygiene, not brushing the tongue very well. Some people, when they brush their teeth, they tend to forget brushing the tongue and the back of the tongue.
That's right.
And this will allow for accumulation of dirt and then could predispose to mouth odor too.
Did you just say back of the tongue?
Yes, so most people don't try to brush all the way to the back.
Okay.
They just brush probably the tip of the tongue. And so there's usually accumulation of dirt on the surfaces of the tongue towards the back.
Wow. As we begin to wrap things up, let's look at this very important area that people will love to know, which is how often should people visit the dentist regularly? How often?
Okay, so that's a very good question. So usually we always preach or advocate that you see your dentist at least twice in a year. So that's every 6 months. But this will also be actually depends. There's also what we call the risk-based call. So usually, depending on the severity of your the dental conditions that you have, you might need to come in probably more frequently than just in 6 months. Some people might need to come at least every 3 months. So depending on the condition that is being managed. But ideally, everyone should see their dentist at least twice in a year.
Wow, fantastic. So now a lot of people complain about the general high cost when you say they should visit regularly. Let's look at the general high cost of medical care, especially the dental care right now. What cost-effective measures would you recommend for Nigerians to manage their dental health?
Okay. So first thing, just like we said, prevention is good. So this would help reduce costs for more advanced treatments. So if you do, like I said before, like visit your dentist regularly, then you do your regular scaling and polishing, this will help cut down on so many other conditions that could come out as a result of poor oral health. But also we have the National Health Insurance Authority Act that also mandates that at least everyone should be under insurance for universal health coverage.
Okay.
So this helps. So once anyone can subscribe to any of the health insurance plans, this also helps to avoid out-of-pocket payments, on which so many of these conditions can then be covered.
All right, Dr. Aigoro, can you specify what type of dental care services are covered by the health insurance plan?
Okay, so it will depend on the particular insurance and also the tier of the package that one is also in. But at least on the basic, most insurance will cover for scaling and polishing, will cover for simple fillings, then for probably taking X-rays. But when it comes to more advanced treatments like root canal therapies or maybe surgical extractions or people that want to get crowns and tending towards more of aesthetic procedures, so some of these conditions are not covered. But the routine scaling and polishing, basic fillings are usually covered by most health insurance plans.
Wow, fantastic. Well, as we wrap up this conversation, Dr. Aigoro, what advice do you have for our listeners right now on how to maintain good oral health?
Okay, so I would like to finish by saying that we the dentists, we're your friends and we are out there to just help, because most people, when they think of the dentist, they always think of pain and extractions and just pulling out their tooth. But that's not very correct, because the aim is to help prevent losing your tooth or avoid coming down with oral conditions. So we always advise that, number one, like you said, prevention is good. You want to see your dentist at least twice in a year. You want to make sure you are brushing at least twice in a day, in the morning and last fasting at night with a fluoride-containing toothpaste. Then you also want to have lifestyle modifications, like in terms of your diet, in terms of smoking, drinking, things that could predispose to oral conditions like cancer. Then also you want to also seek care early, which is very important. Then also you want to make sure that you also try and enroll for insurance, because this would help cover a lot of treatments so a lot of the basic treatments are actually covered under insurance. So seek insurance and subscribe to an insurance plan, which will help to prevent out-of-pocket payments and reduce costs of treatment of more advanced conditions.
Wow, well said. A wise man said a word is enough for the wise, and you have been a wise man, sharing with us the advice on how to, maintain good oral health. On that note, we'd like to say big thank you to Dr. Oluwadamilola Aigoro, a resident doctor from the Department of Oral and Maxillofacial Surgery, Lagos University Teaching Hospital, LUTH, for sharing these useful tips of the topic of today, which is your health, your teeth, or better still, your teeth, your health. Well, we'd also like to thank you, you the listener, for tuning in to Health Insurance Today on radio. And of course, and this is brought to you by Acer Communications Limited. We hope you found our discussion today very informative and helpful. And let's let you know that you can actually have access to affordable preventive care and treatment of dental or teeth conditions if you subscribe to a health insurance plan today. If you would like to know how to subscribe to health insurance plans for you, your family, or organization, or you just want to know more about the topic of today, please call or send a message to 0901 538 8634. I say that again, 0901 538 8634. You can also send an email to info@healthinsurancetoday.ng. Once again, info@healthinsurancetoday.ng. Don't forget to tune in next Friday, same time, for more information and insights on health insurance. Until then, stay healthy, stay informed.